Hi, everybody.
Hello. Well, it looks like we have all kinds of people joining us, so we want to welcome you. And it looks like we have comments from Randy and Paula. And this is Brittany here beside me. She's been
Hi.
commenting too.
I
So
am Brenda's little helper.
we're so happy you guys are here. You guys are going to enjoy this one. This
Mm-hmm.
this support group, I was telling Brittany, like took me longer than most of my other ones to put together, probably 2 or 3 weeks, and it's just packed full of amazing stuff. I'm just really excited. And what we're talking about today is traditional and non-traditional ways to support healing and pain management. And I'll talk a little bit more about what inspired me here in just a moment. But I'm going to let Brittany introduce herself first.
Hi, everybody. So, as I've said and as Brenda said, my name is Brittany. I help Brenda do these monthly support groups. And we do have a couple new people, so I'm going to kind of repeat some information that we usually go over. We do these support groups every third Thursday of the month, and it's different topics. If you have a specific topic that you would like us to cover or you have questions, it may not have to do with what we're talking about today, but feel free to use the chat box. And someone did ask when this is live, is it a chat or a presentation? So it's a little bit of both. Today, Brenda's going to be showing her handouts that she worked really hard on. So she's going to be sharing her screen. I'm going to be sharing my screen a little bit later today, too, because ProCare Health is our sponsor. So towards the end, we are going to share some of our wonderful products that we have just specifically made for bariatric patients, too. And then we actually have a little surprise for you guys at the end, too. Right, Brenda?
We do.
Okay.
We sure
I didn't
do.
want to
I got
misspeak.
it all ready. I got it ready.
And then before I forget, if you guys could do us a huge favor, today is actually National Get to Know Your Customers Better Day. So I'm going to copy a survey in the chat box after I'm done giving my spiel. And if you guys could just take the time and do that, it'll take probably less than 30 seconds. I believe it's only 4 questions. So I'll post it at the beginning of this presentation, and I will also post it when we're getting close to the end too, in case it gets buried in there and it's hard to find. Um, but yeah, I think that's it. I've been with ProCare Health for almost a year now. Brenda and I do these support groups, like I said, every third Thursday of the month, 5 p.m. Central Time. And we also do weekly live events too. So we will, towards the end of the presentation, we'll share our Crowdcast channel, which is the platform that we're using today. But we'll share our Crowdcast channel so you guys can go in and watch previous live events or previous support groups too. We record those as well. So it's a resource and it's all for you guys and it's all free. It doesn't cost you anything. So we'll be happy to share that with you at the end of the group tonight. Okay?
And if you follow us, there's a little button. You press follow. You'll get a little email 10 minutes before any event starts. And if you can't watch it during the event, you can always come on and watch it later as a replay. I love watching replays. I do that with a lot of my podcasts that I listen to and that type of thing.
Mm-hmm. And
And we
what's
have
nice about this group is that you don't actually have to watch it if you don't want to. You can just kind of listen and I've heard some people just listen with earbuds like I'm doing right now and walk around and clean their house and do whatever they got to do. It's nice you can do it whenever, wherever. So just need Wi-Fi,
yes.
right?
Yeah, yeah, and you don't have to be on screen, which is kind
No.
of a positive thing.
Yeah.
Um, I want to welcome too. It looks like we have a lot of people joining. We have B. Arlene. I hope I'm pronouncing that right. Renetta, Deborah, Jessica, Randy, Paula, Tara Lynn. So welcome everybody. I also want to mention there's a button that says ask a question at the bottom of the screen, and we have 8 post questions. It's kind of our little outline for our presentation, but please feel free at any point to post a question there or post a question in the chat box. The good thing is with ask a questions, what it will do is timestamp that on, like, let's say you got to leave early and you have a question. You can put the question on there, and if you can't stay for the whole presentation, you can come back and watch it, and it'll be time stamped for you. And are any of these other questions that we already have on there, if you are able to, if you want to come back and you want to listen to a certain part again, those are timestamped for you too. So it's kind of just makes it easy. We're also getting ready to, we have a YouTube channel that we're developing, and we've started downloading all of our support groups on there too as well. So that's kind of exciting. Okay, I'm gonna kind of do just a tiny little introduction of myself as well. So my name is Brenda, and I've been with ProCare. I've known them since about 2012 or 13. I was a bariatric nurse coordinator for a weight loss surgery program in Cape Girardeau, Missouri, and whenever I worked with that program, we sold ProCare products out of our clinic, and so I just became familiar with them. The ProCare office is located out of Lake St. Louis, Missouri, and our office was probably like less than a couple hour drive from there, so it kind of worked out well. Like they came and helped us with some support groups and different things like that. And then that relationship developed, and I became here recently a consultant for them full time. So I work, do support groups, do these live broadcasts, do blog posts, just support to programs and to patients. Basically, is a lot of what I do. And my background is I worked in the bariatric surgery field. Like I said, since about 2012, I had bariatric surgery myself. I had the sleeve gastrectomy. I also have always been really interested in personal development and healing, and I had worked in an emergency department prior to bariatric surgery for about 20 years, and through that, I saw all kinds of pain. And I mean, from trauma to medical issues to whatever. And it inspired me to learn more about healing. And I went through a program called Healing Beyond Borders and became certified in something called Healing Touch. But along that, I also studied a lot of other modalities and techniques. So, what this is why part of why I'm so excited about being here today, because I love sharing that part of my background. I don't get to share it that often, and I love that part. So, anyways, that's a little bit about me, and looks like Brittany's posted the links. So we're going to go ahead and get started because we want to get to the meat of everything. We want to make sure to be
We
able to
have
share some
a lot,
major things.
and we have a lot tonight for you guys
We
too.
sure do. We sure do. So you're going to see me kind of share my screen. And I am going to, when I share my screen, we're going to talk about what traditional and non-traditional pain management, what we're gonna be kind of sharing more about. So you're gonna see a little PowerPoint. Brittany, I'm gonna have you. Oh, there's one of my later slides. We'll talk about that here in a moment. So that's just a picture of me. Brittany, can you see my screen? Okay.
Yes.
Okay, I'm gonna try to make it my slides as small as possible.
If you guys are having visibility issues, make sure that you say that in the chat so I can have her fix it, because I'm on a computer, so I can see it perfectly. But those of you who may be using your phones, you might have issues seeing the presentation. So
Yeah. Let us know. We want to know. And this is meant to be interactive because it is a support group. So we want to make sure and be able to have you guys interact. Tell us about yourselves in the chat box. Tell us about your experiences. I know a few of you shared that this was your first timers here, so we're so excited for that, because it is fun to learn from other patients too as well. So make sure, and if you have something to put in that chat box and tell us about you or tell us about something, let us know because it'll help sharing with the group. So the big things that we're going to just be talking about is traditional versus non-traditional methods of pain management and bringing those together for best practice. So traditional medications, over-the-counter supplements, herbs, nutrition, and cold and hot therapies. Non-traditional being things like aromatherapy, self-care, art therapy, music therapy, color therapy, meditation, body work, and biofield therapies. And then playing with the methods. I have a couple different handouts that we're going to be talking about and sharing with you to give you some extra little tidbits of information that you may have not even considered or thought about. We do have a link at the bottom of this of your screen that says it's a link to the handouts, but I also put it in the chat box as well. And that we'll talk about that again at the end of the program. We'll share that as well to make sure that you can find it well.
I just shared
So,
the link again if for
oh,
anybody who's
good.
having trouble finding it.
Thank you, Brittany.
You're welcome.
So here, traditional versus non-traditional. Traditional medicine is the sum, knowledge, skill, and practices based on kind of like theories and beliefs. It's basically what people term as Western medicine. Okay, it's what when you go see a doctor, when you go see a specialist, when you go to have bariatric surgery, all of these things are considered traditional. Now, non-traditional is more along the lines of what they might call complementary medicine, and complementary medicine means it complements the traditional therapies. Alternative, some people refer to alternative as being an alternative to traditional. So they're kind of a little bit different meanings. And depending on, your thought process and your background, you may be more drawn to one than the other. But they basically are just a set of practices that are not part of your own country's tradition or conventional medicine. Okay, and we'll kind of go into in more depth to what that means. And I'm going to stop sharing for just a second because I want to make sure and timestamp everything as we're going along. So you're going to see me back on screen here for a second, and then the next thing we're going to be talking about is what medications, prescription, and over the counter that can be used for pain control after bariatric surgery. So I'm going to go back. You're going to see me share again, back and forth, back and forth. Back to my slides. Okay. Can you see that, Brittany?
Yes.
Okay, this is all based on bariatric surgery because most of you who are joining us are in the bariatric surgery world. If you're not in that world, stick up your hand and say hi because there's definitely things in this that you will find that'll be helpful to you. But you're going to find that we're really basing a lot of this information on the bariatric surgery patient. And the first thing we're going to talk about is pain medications, prescription versus non-prescription. So this is when we talk about pain control, one of the very first things is medications. And I can remember like I said, whenever I worked in the emergency room, that's one of the first line things to help somebody who is having discomfort is a pain medication. You can give it through an IV, you can give it through a tablet, you can give a shot, whatever it may be. Now, I will say, for me, after having bariatric surgery, I did use some pain medications, right? Like that first week post-op. That's pretty common. And I wouldn't feel bad about that at all. The more your pain's controlled, the better that you're going to be able to do the things that you're supposed to be doing. Like if you're feeling better, you're going to be able to eat. Or actually that first week is just drink mostly. But you're going to be able to get up and physically move around, which is super important to help prevent complications like pneumonia and blood clots and things like that. Some common prescription medications that are considered what I would say narcotic would be things like here we have on the slide Lorcet, Elixir, Percocet, and Vicodin. A lot of times that first week post-op, patients will be prescribed strong pain medications in a liquid form because it is a little bit sometimes hard to swallow just because your stomach is so small and it's kind of swollen after the surgery. So it just helps with absorption a little better. So that's pretty common. And then pain medications that to use with caution, being monitored, talk to your doctor regarding some of these. And I'm going to kind of mention some. One other thing I want to mention besides just the pain medication, over-the-counter medications might include things like Tylenol or acetaminophen. Those are typically, generally for most people, pretty safe to take after surgery, okay? So to use with caution or not use, your surgeon is going to tell you specifically. They probably will give you a list of things that are acceptable, not acceptable. NSAIDs, which are considered non-steroidal anti-inflammatory medicines such as Advil, naproxen, ibuprofen, Aleve, Advil, Motrin, aspirin, Lodine, and Diubid, may depending on your surgeon, may or may not be recommended because they can inflame the stomach. They can increase your risk of gastric ulcers after surgery. And with having stomach surgery, you have to be really careful with the anatomy of the stomach because development of an ulcer can be extremely painful. It can be even very difficult to treat sometimes, and it can be dangerous. It can be very dangerous. So keeping away from those things as much as possible. If your doctor does recommend taking those, for an acute illness, then I would say something like Pepcid taken along with it to help decrease the acid production and help decrease the inflammation alongside that may be helpful. But I am not I am not prescribing anything for you. That would need to come through your doctor. I'm just kind of
Mm-hmm.
telling like general recommendations. Some other things to kind of consider is COX-2 inhibitors, which are things like Celebrex or Bextra. They're a little less harmful than NSAIDs, and sometimes those are recommended over NSAIDs. So that would be something to talk to your physician about. And then the last one here I have here is sustained or extended release. So some types of surgery really affect the absorption of your medications. And so some pills need to be taken in consideration if they're extended release or sustained release. So definitely those would either need to be monitored or changed. Okay. Another one I have under that is tramadol. So just again, just talk with your doctor about your medications and make sure that certain medications are discussed before surgery. Some larger tablets may need to be changed, for example, like diabetic medications. Um, some medications can be crushed or made liquid. Some can be made chewable, but not all of them. So you need to make sure and check on those things. I hope that makes sense. Is there any questions, Brittany, before I kind of go on to the next slide?
Not that I see, but there is something I wanted to say real quick because I think we do
Uh-huh.
have a couple of people in here that are pre-op,
Okay.
right? Yes, pre-op. Um, so I have heard of patients having issues before with not being able to take NSAIDs and extended relief, and I don't think we covered gel capsules, but usually those are a no-go too, correct?
Um, maybe. You know what? I'm not really sure, to be honest. We never really discussed that with the program I worked with gel caps, but that's a good question. I guess it depends on what they're made out of.
Yeah.
If they're made of like a vegetable coating, I don't know. That's a good question, Brittany. I don't know.
Well, like the NyQuil liquid gel capsules is what I was thinking of. I thought that some programs didn't recommend those, but I could be wrong. But basically, what I'm just trying to say is make sure that you are following your bariatric facility, your surgeon, your program. Make sure you're following whatever they're telling you very strictly, and don't just think, well, I'll just take one this one time and it won't affect me because when you do get the surgery, your whole body is changing, and the way that your body reacts to not only food and nutrients and vitamins and all of that good stuff, but also drugs too. So
Absolutely.
just make sure. I just really wanted to stress that since we do have some people who are pre-op. Um, just make sure you're really following the guidelines really closely. And then Randy said if you have a headache or something, you can normally take Tylenol. And I believe that's not an NSAID.
Yes.
So yes, that would be fine.
Yes. And actually, what you want to look for too, like let's say you have a cold, you
Mm-hmm.
also want to look at your cold medications to make sure they don't have NSAIDs or aspirin in them.
Because a
It's
lot of times they
acetaminophen or
will.
Tylenol is okay.
Yeah.
Yeah, because sometimes they will. Okay, so the next thing we're going to be talking about is how can nutrition help with decreasing pain and getting over illness more quickly. Okay, so I'm going to go share my screen here again. And we're going to go back to the slides. Um, there we go. And this is our next slide. So nutrition. So there is some evidence that suggests that daily portions of fruit and vegetables, olive oils, nuts, legumes, like a Mediterranean style diet with adequate micronutrients like omega-3s, vitamin B12, and magnesium, coupled with reduction in processed foods like certain meats and white flour products can be anti-inflammatory. With potential benefits for people who have chronic pain. Um, Also, I know that I've had several friends that have been diagnosed in the past with cancer or some kind of medical condition, and changing their diet seemed to make a huge difference. So it is something, we're not going to go in depth in this particular program, but if that's something that maybe resonates with you and you feel like it strikes a strings, like a guitar string, it strikes something within you, and you feel like you want to learn more about that, that's something definitely to check out and research, because food can make, I mean, that's, they say you are what you eat, but it's true, that food um, can make a difference with our health. So just a little note on that. And I am going to just kind of, you're going to see me here on the full screen again, and I am going to stop answering that one. So the next thing we're going to talk about is heat or cold therapies and how those help with pain management. Okay.
Sorry, I had to sneeze, so I muted myself.
Oh, that's okay. Hey, that's good. Okay, let's see. Give me just a second here. I'm going back to my questions. Actually, it looks like it kind of took them out of order. Give me just a second. Let me see what the next one here is. Okay, heat and cold. Okay. So,
Oh, thank you,
so
Randy.
how can
You said God bless. That's so nice.
oh so how can heat or cold therapies help with pain? So you're going to see me share my screen here again, and we're going to go back into the slideshow, the slide presentation, and I'm going to just kind of talk about that. This has kind of even confused me a little bit, because being in the medical field, we use cold versus heat therapies on all different kinds of injuries, especially those being acute, meaning those that happen suddenly and come on quickly. And so really and truly, part of what I want to say is kind of think about what feels best too, depending on what's going on. As a general rule of thumb, ice for really things that happen very like you break your ankle or you sprain your ankle or you have something happen very quickly and there's a lot of inflammation and swelling. And then heat for muscle pain or stiffness. And I know a lot of patients after weight loss surgery would use heating, like a heating pad over their abdominal area. You have to be kind of careful because you don't want it to get, you don't want to leave it on more than about 20 minutes or 30 minutes on a low setting, but it can kind of help relieve some of that discomfort. So cold therapy for injuries, okay, ice packs, you can use frozen vegetables. The acronym RICE is sometimes helpful to remember. So RICE stands for rest, ice, compression, meaning like an ACE wrap or something that kind of holds that joint stable. And then elevation, meaning you raise it up above your heart level. And then hot therapy promotes blood flow and helps the muscles relax. Again, like a heating pad or something warm. Sometimes I've seen the little rice bags that you can put in the microwave and put it around your neck or whatever. Sometimes those are really helpful and can help you feel better pretty quickly.
Oh,
So
are
we
you
got
talking
that.
about the ones that you can put in the microwave?
Yes, I love
So
them.
they actually make ones that have aromatherapy in them too, which is nice. You can put
Yes.
essential oils, and it's very nice for people who have anxiety too, I will say.
And that kind of reminds me, now that you're talking about that, there are heated things to sleep on too, like heating blankets. The other thing is
A weighted
um,
blanket.
a weighted blanket. When you said that, it made me think about a weighted blanket, and that can really be helpful for anxiety or just making you feel really snug. Um, there's been lots of studies done, and basically it just is a blanket that has weight on it, and you lay it over you, and it just helps you feel really safe and secure.
I'll find that.
Okay. The very next thing we're going to talk about is self-care. Let me find my little question and answers. Okay. So what are important self-care therapies that you can use to decrease pain and feel more in sync with your body? And I was telling Brittany to this last year starting out has been extremely a little bit crazy for me. Um, and so I just needed today. I've been wanting a massage, so I just went and scheduled me one and took an hour out of my day for my lunch and got a massage, and it was amazing. So those little things like that. I'm going to share my screen here. Okay, here we go. We have more people joining us. So hello out there if you're just coming on. So self-care is an activity that we do something deliberate in order to take care of our mental, emotional, and physical health. It's improved mood. It helps to improve your mood and reduce anxiety. And it helps you to build a relationship with yourself. Like a warm, long bath, a walk in the park, a good sleep routine, or spending time with friends. And really, I mean, we hear these kind of things all the time, but like ask yourself, what can I do for myself today? Just for myself, like not for anyone else. And that sometimes it's just like taking a minute away to go spend time in the bathroom by yourself where you're not having 20 people ask you questions and you're just reading your phone. I don't know. How about you, Brittany? Do you ever find yourself just finding like little things like that to do, for
Yes.
yourself?
Yep.
Um,
Mine's going to
so
get a pedicure.
oh, I love pedicures. Anybody
Yeah.
else? Anybody else have anything that they do just to, it's just those little tiny things. Sometimes I love just lighting a candle and sitting out on my front porch. We have a really pretty view in front of our house, and I love in the evening times when the sun's setting, just sitting out there and just enjoying that. And that is just me time. It's not, sometimes my husband will sit out there with me, but I just like having some things that I really enjoy. So tell us if you guys have other things that you like. Tell us what your things are. Okay, I'm sorry if my screen went blank, but here we go. We'll go back to, we're going to talk about massage too. We talked about, I told you I had a massage. Basically, it helps with relaxing muscles, tendons, joints, relieving stress, relieving anxiety.
Hmm.
I have helping close the pain gate by stimulating nerve fibers, and stopping those pain messages to and from the brain. So it just helps you kind of relax and get in a state of where you're in sync with your body and in sync with everything. You kind of let go of all those worries for just a few minutes. It's a wonderful thing. And then chiropractic techniques. A system of therapy focused on the structure of the body, particularly the spine. And sometimes they'll do manipulations on the spine, sometimes heat therapy, sometimes cold therapy, I can't think of the name of it, where they use the little electrodes and they put them on the body and send little stimulus to help stop the pain signals. So there's all different kinds of things in that field that can be really helpful.
We have a few comments too.
Okay.
Bobby says taking a walk in the cool evening air. That's honestly that's why fall is my probably my favorite season because it's you can take a walk pretty much any time of the day. Gloria said shopping and going to lunch by myself. You know what's so funny about that, Gloria? I'm so happy you brought that up because I recently just got married in May and I was really stressed out with all the wedding planning and just it was too much for me, honestly. And one day I was like, you know what? I'm going to take myself to lunch. I've never been to lunch by myself. I'm almost 30 years old and I've never been to lunch by myself. And that's actually one thing that I've been trying to be better about is being more comfortable with being by myself. And I went to this nice little taco joint and it was such a nice day. I took my dog with me because they allowed dogs on the patio and it was so nice. I mean, it was wonderful. I and now I wish that I had more time to do that all the time. So I
Yeah,
agree with you.
the thing is too is we schedule time with other people all the time, and we
But you don't
schedule
make
like if
time
our
for
kids, our
yourself.
family. I know,
Yes. Yes.
so important, so important. Um, the walking thing is, I'm going to share my screen here again. The walking thing is just like amazing. Like that can be a whole thing in itself, just like you said, walking your dog or doing whatever is such a helpful thing. And
And
so here we're gonna.
Randy
Oh,
said reading books, and Tara Lynn said spending time and petting my dogs. Yes. We're also dog lovers. I have two, so and Brenda has you have just Hank, don't you?
I have Hank, my dog. Yeah.
Yeah. Okay,
Good
sorry. You
old
can keep
Hank.
going now. I
Good
just
old
want to read
Hank.
the rest of
No,
this.
that's totally fine. Um,
Hmm.
I kind of I kind of skipped one of the questions here, so I'm gonna go down and start. So we're gonna be off sync with some of these. Um, this one here is, can you tell me more about aromatherapy, herbs, art therapy, music therapy, color therapy, meditation, bodywork, biofield therapy? So we are going to start answering that question. So I'm going to share my screen here. And I'm going to go down to that. Here we are. So this one I'm excited about because I love this. Aromatherapy can be effective for treating a lot of different kind of medical conditions. It can help with anxiety, with depression. So essential oils are from plants and herbs and can be inhaled or applied directly to the skin. Can be used topically. And so carrier oils are naturally derived from vegetarian sources. So sometimes you use essential oil with like a carrier oil to kind of dilute it a little bit so it's not so strong on the skin. So you can use things like coconut oil, sweet almond oil, olive oil. And I have a handout on aromatherapy, which I'm going to show here in just a moment. But I'm going to show you my own little, I have an herb garden. So I took a picture of it here before we started a while ago. So here I have, I don't know if you can see my cursor. That's like sage. And then I have lavender. I have some parsley, some dill. Actually, I have two different kinds of parsley. Down here I have some um, sage, some rosemary. It's kind of hard to see on these pictures. And I have some oregano. Actually, I'm going to stop and I'm going to show you some of the what some of these things look like. And we're going to talk about the benefits of them alongside that. So, one of the first things is I have my bag of lavender. I'm going to show you what lavender as it smells so good, smells so amazing. So you can take these leaves, you can actually make like a tincture with them, like put them in something. Um, use the oil that way. Or you can buy essential oils. Like I have all kinds of essential. I started bleeding. I cut my hand somehow. Um, lavender. See if you guys can see that. This in here is Young Living, but there's all different kinds of brands out there. They just smell. I wish I could let you guys smell this because it smells so. Where's my camera? It smells so good. You smell it? So lavender. Lavender, we're going to talk about here in a moment. When we start the slide presentation or the handout. I'm going to have the handout here and available in just a minute. The next one here I have is basil. And basil looks like this.
Oh,
So you
I
guys
love
can
fresh
see that.
basil.
Oh, you
Make a
can put these on your
pesto.
foods too. You
Yeah.
can put them on all, especially um, like pasta house type of food. What is that? Would that be?
Italian.
Italian. I couldn't think of the word for it. So that basil also, you can also have like essential oils with that in it, and that is very good for inflammation and joint pain, arthritis, fibromyalgia, all of those kind of things. So you can put these kind of herbs on food. You can use oils. What happens is how essential oils and how these things work is everything is energy. Food is energy, herbs are energy, these oils are energy. And they have a specific, I'm going to get kind of a little deep here, but they have a specific energy has specific vibrations and frequencies. And you can change your body's vibration and frequency by eating these kind of things, or drinking these kind of things, or putting them on your skin or inhaling them. And your body kind of will start resonating with that energy of the oil or the food or the spice or whatever it is. And what happens is it will raise it to a certain level where it helps with the pain control and that type of thing. That's the simplest, most simplistic form of information I can give there. The next thing here is thyme. So I have thyme. I'm going to show you what that looks like.
Thyme is
So
a nice spice to cook with too.
it is. Oh my gosh,
I
it
like
smells so
putting
good.
that on grilled chicken.
Mm, that's what that looks like. And there are essential oils that you can get that save time on them. It's probably backwards because the camera. So I'm going to kind of put these over to the side for a moment. Because I got more. All of these, thyme is a really good one for inflammation. All the ones that I'm mentioning are good for inflammation and for pain. Okay. There's other specific characteristics we're going to mention on the handout here in a moment too. But I also here have sage. Oh, this was supposed to be oregano. Oregano, I don't have along with me. I guess thought I cut some, but I guess I didn't. This here is sage. Sage is good for inflammation as well. It's also good for purity of the mind. Oregano, though, is super good for inflammation. It's one of the best. It's also good for skin sores. It's good for indigestion. I have essential oil here with that. They make them in almost all these herbs. You can get aromatherapy as well. Put that over here on the side. One more I'm going to show you here real quickly. And that one is mint, peppermint. You guys see that?
Mm-hmm.
Smells so good.
Oh, is there
So you,
blossoms on that? I've never
it
knew that.
is. Yeah, they're like purple. Oops. Can you see that? Bring it up to the camera just a little bit better.
If you put your
Um,
hand behind it, it'll zoom in.
oh,
There
thank
you
you.
go.
Yeah. So,
Wow. I never knew that.
so you can take the leaves. You can make a mojito with this if you can drink. But lots of properties in that. But yeah, they're like put my hand behind it. You can take like a little twig and you can put it in your tea. You can put it in your water, things like that. And then there's essential oils, of course, that go along with that. Peppermint that you can use. So I have those. I'm gonna pull up the handout now too, Brittany.
So, in those little tinctures, those essential
Hmm.
oils, how would you, like if for someone who's not familiar, such as myself, how would you use them? Can you just put drops
Yeah.
on them and kind of put them on
So
like
you
your
just
pressure points, or?
open them up. Yep, you can. Some of them you can just apply directly to your skin. This is peppermint. You can put it behind your ears. You can actually you can actually put peppermint in your mouth and you can taste it. Some of these you can actually put that helps with like I said, it can help with indigestion. It can help with joint pain. It helps with headaches. With headaches, you can take peppermint and just kind of put it on your temples, kind of rub it in. Um, but it smells amazing. For more details regarding, how to specifically use them, Google it. I would say each one is a little different on whether you can apply them directly to your skin or you need like an oil, like a base oil to put with them.
Have you ever
Um,
used any of those diffusers? I'm just curious.
oh
I
yeah,
never
thank
have.
you. Yes, I have
I
several
would
diffusers.
like to get one at least for common areas like my living room, maybe bathroom, bedroom, but I've
Oh, they're
never gotten
wonderful.
one.
They have essential oils too that are really like one of them with Young Living is called Thieves, but I'm sure there's other companies that have different mixtures, and they have like a mixture that's supposed to be good for killing germs, that type of thing. You
Oh.
can diffuse it in your house, and they have one that's eucalyptus that is really good for like clearing the head and that type of
Hmm.
thing. So we're kind of going off a little bit. Somebody put mint works good in protein smoothies. Ooh, I bet so. And Dorothy says everyone needs a little time. So true. Boy, I can feel that mint working. It's like, whoa, that stuff's some strong stuff. Woo. Put it in your bathtub while bathing. Oh, that's a good idea. Yeah. Some of these herbs you can do that. I know that
Hmm.
there is actually so if you get a massage, um some massage therapists do something called raindrop therapy where they use a lot of the different essential oils in their session and they rub them into the skin to help with pain control. So that's another really popular thing. I'm going to share my screen here and I'm going to go to the handout on aromatherapy. So, and I'm going to make this a lot bigger. This is what it looks like, guys, when you pull it up. We're going to give you the handout. Lavender is the one that I kind of showed you first. There's a little picture of it. Effective analgesic and anti-inflammatory can be applied, help directly to the skin. One thing I love about lavender, has a very soothing thing. So, Brittany, you were talking about putting lavender on like you can use herbs in some of your like pillow, the thing that you heat up in the microwave, the sleeve that you put around your neck.
Yeah.
What is it for? It's kind of like helps to relax your muscles. But a lot of those will have lavender in them because lavender is very good for relaxing muscles and for helping with anxiety or stress. So that's a really good one. The next one is rosemary, and rosemary can be used for headaches, sprains, muscle soreness or pain, rheumatoid arthritis. It has anti-inflammatory and analgesic properties. Helps with blood circulation, can help with pain control, helps also in aiding of coagulation of wounds and speeding the healing process. And you can apply that one directly to the skin as well if you're using like an essential oil. But you could, like I said, you can put some of these in your food. And peppermint, the one that I just talked about, it contains menthol, which has a cooling effect on sore, achy muscles. Can be used as an analgesic and a spasmodic, which means helping with pain spasms. And you can dilute and apply to the skin. So that one you probably would put a little bit of oil with it. Peppermint can be used for headaches, irritable bowel, nausea, common cold, muscle soreness, pain. Kind of just reading off my little handout here. And then we're going to go down to the next one here, which is the eucalyptus. And I didn't have any eucalyptus with me, but eucalyptus oil is one I mentioned about using it in an infuser. You can use that to help with common colds and cough. It also can help to be applied to the skin to help with arthritis and skin ulcers. It's in a lot of over-the-counter creams and ointments. Can be used with osteoarthritis and rheumatoid arthritis. Dilute and apply to the skin. So that one is it can kind of cool the skin a little bit too, kind of like peppermint when you put peppermint on the skin. And wintergreen is another thing too. I have along with me, but I did not show you. But wintergreen is also super helpful for those kind of things. So ginger, I thought it was interesting. I was grocery shopping the other day and I saw a piece of ginger that they were selling in the grocery store. I'm like, I didn't even know you could just buy ginger by itself, but you can apparently.
Oh yeah, you can. They're starting
Yeah,
to I've seen it more commonly at Aldi too now.
really. Have you bought it
Yeah.
before? Used it?
Yeah, I have. I actually have this food humidifier and I've like dried it out and then grated it. And so then I have my own ground ginger that's more fresh than if you would buy it online. And actually, I can't find ground ginger in grocery stores right now. So that's another
Hmm.
reason why I did that. But
What'd
yeah,
you put it on, Brittany?
most like Asian dishes that you make. So like we did a few months back, actually it might have been like 6 months ago. We did a meal prep for one of our live events. And I did egg roll in a bowl, and it's really high in protein and it's low carb and low in fat as well. And that recipe calls for I think like a tablespoon, maybe a little bit less, but it's like a tablespoon or so of ginger, and it kind of just gives it like that more like Asian taste. I don't know how to describe it. It's
Hmm.
kind of sweet but kind of zesty at the same time. And it's something that I didn't think I would like, but if you're making Asian food at home like that, it's just something that makes it taste like it's from an actual restaurant, if that makes sense. Like it's something so small you wouldn't think about, but it makes a big difference in the taste.
Well, it's good to know. And two, I've known whenever we've been on trips before, ginger can be really one of those things really helpful for nausea and digestion. Also, besides helping with inflammation. So like if you're traveling and you get a little nauseated or, car sick, ginger can be really helpful with that. I'm going to stop sharing my screen here and I'm going to go back here to, okay. Um, Give me 1 second.
Also, while she's sharing this, I'll go ahead and copy and paste that handout in there, that specific one, in case
Yeah, and you
anyone
know
needs
what? Maybe
that.
the meal prep one you were talking about too.
Yeah, I'll find that link too.
Okay, and I'm going to share my screen again. And the next slide here, we're going to kind of talk about art therapy. So, art therapy is a technique rooted in the idea that creative expression can foster healing and mental well being. It helped to explore people's emotions, develop self awareness, cope with stress, boost self esteem. And although we don't think about it being directly related to pain control, it can be in that, it's a distraction. It helps you when you're not sitting there thinking about how terrible the world is and how many crazy things are going on. It can be a great distraction, and it gives you something in result of that for other people to enjoy as well. Let's see here. We got music therapy. This is probably one of my favorites. So it basically helps reduce stress, promote relaxation. It can be even as effective as prescription drugs, even though you don't think about it. So it can be as simple as listening to certain melodies, playing an instrument, drumming, writing songs, or guided imagery. So there's lots of different ways to do this. I think there's actually, again, I'd mentioned that my background, I've been really interested in different types of healing techniques. And there is something called sound healing. If you Google that you can watch YouTube videos. There's tons of different sound healing, and there's different. What happens is again, it's about the energy of it, the vibration and the frequencies of the music can affect your body. And so we don't always think about that when we listen to things. Sometimes things resonate with us more, like you're like in the mood for it, and you turn the
Mm-hmm.
music all the way up. It makes you really happy. But it can affect every cell in your body. When you think about it, you turn music up and the tables will vibrate. Your if it's loud enough, or your windows, if you have something that has a really strong bass, you can definitely tell that. So it can affect your body. It can definitely affect the healing process and help with pain control. And color therapy is something that I've been really interested in the past. It's an alternative remedy that uses color and light to treat physical, emotional, mental well-being by balancing the body. So color therapy has a motivating and encouraging effect on people. So it involves um, we don't think about it. We use color in everything, and we do it so we don't even think about it. The foods that you eat, the clothes that you wear, the clothes that you wear either resonate with you or they don't. Like you feel you're drawn to a certain color on certain days, and that's to help bring your vibe up, I guess you might say. Um, the drinks that we drink, if you're sitting there drinking something that's red versus purple versus whatever. um, and also I have something too here, laser light therapy. Again, I told you that I studied different healing practices, and you can actually use a light therapy. I'm going to kind of change my screen here, Brittany, just for a second.
Okay.
Oh, you guys aren't even seeing my slides. I guess had been the whole time I'd been reading my slides, and I didn't have
Oh,
my
I didn't realize that you
camera
were
on.
trying to share it. I actually just copied and pasted the color therapy handout too, so that's what I was
Oh,
doing.
good. We're going to be talking about that. Here I am reading my slides, and I thought everybody was with me on those, but I'm talking through them anyways. It's all good. So you can actually, here is, I have a color therapy kit, which is a light. It's just a simple little flashlight with all different kinds of attachments with different colors that you place onto that. And I mean, it is such a thing. Color vibration therapy. Um, show you my little light kit here.
Oh, that's so
Lots of different
cool.
colors. But it definitely has an effect. I remember after my bariatric surgery, I was feeling very weak. It was about at a week, and I was just really tired and really weak. And I thought, I'm going to get my color therapy kit out and do some color therapy on myself. Certain colors can really help with healing. And and we're going to talk about that here when I pull up the handout, but you can use those to kind of energize your body when your body's not, because your body is made of light. It's made of light. So
Hmm.
just interesting little thing. And it made a huge difference. Like my body shifted very quickly after doing some light therapy. My energy level increased. I'm going to go to the handout so that I can kind of share this a little bit better. And we're going to talk about color therapy. Okay,
I
here we go.
I was gonna
So
say, can you zoom in a little bit? It's hard to read.
yes. Here's what the handout looks like when you guys get it, but it's going to make it really big. So, violet, purple, it helps stimulate your intuition, imagination, self knowledge, meditation, artistic qualities, peacefulness. It's associated, so each color is associated with different organs of the body in frequency and vibration. And so, with violet, purple, you have your upper brain, your right eye, and your pineal gland. It's associated with something we call the crown chakra, which is right up on the top of your head. Can you see me, Brittany, at all on the
Yeah.
little pictures below? So you can, um, it's like with your crown chakra. The indigo color is stimulates self-responsibility, inner strength, creative visualization, intuition, calmness. It's associated with this area right in through here, which is basically um, they call it the third eye chakra, which is an energy center, but it's lower brain, left eye, nose, nervous system, hearing, nose, smell, and taste. So it can stimulate those parts of your body. And these are all intertwined. I almost feel like the energy sits on top of each other, like the different colors. But blue is associated with this whole area and through your throat area, called your throat energy center, throat chakra. Stimulates calmness, communication, honesty, truth, self-expression. Associated with your bronchioles, your vocal cords, your hearing, your throat, your neck, your swallowing, ability to talk and express. Green is associated with support, supportive, balance, harmony, love, social, nature, acceptance. Um, it's associated with your heart, your circulation, your arms, your chest, your hands. So all of this, the area right in through your midsection, like upper midsection here. Thymus gland. Yellow is associated with fun, humor, lightness, personal power, intellect, logic, creativity. It's associated with your stomach, which, after bariatric surgery, your liver, your gallbladder, your upper abdomen, your colon, your pancreas. And infusion of extra. So you can have either too much color, like a certain color, you can have not enough. Likely after surgery, it's probably a little depleted. So adding a little extra color therapy may be helpful. Orange stimulates creativity, productivity, pleasure, optimism, enthusiasm. It's associated with the reproductive system, your lower abdominal area, your colon, your urinary tract, your adrenals. So that whole mid area down, kind of right above like your private area, and that is called the. I'm trying to think. My mind went blank. Ah, I'll think of it in here in a second. But it's a whole energy area also as well. The red is what they call the root chakra, and it increases physical energy, stamina, grounding, spontaneity, stability, passion, associated with your spine, your hips, your back, your knees, your adrenals, and that type of thing. So that's just a little bit on color therapy and incorporating into your lifestyle. We kind of talked a little bit about that, but things in your foods, your drinks, your clothing, even certain colors of sunglasses. And so you can either add colors or you can subdue colors to bring about a lesser effect on them. I know that's so. I feel like I'm not giving this information service because it's so there's so much here, but it's just an introduction to kind of let you know, kind of like what some different ideas. So you can always dive in and research some of these things even more. Um, And then the next thing I have is, let me look here real quick, is meditation. So we're going to talk about that for just a second. I know we're kind of getting closer on time.
And
Um,
I'm really anxious to see what you have to say about this too, because so you guys, we actually just got our part of our job is our boss was nice enough to get us a trainer that we're all using. And one of the things that she asked me to do is to try and start meditating for my anxiety. So I'm really excited to hear what you have to say about this.
And you know what? It just is a little practice. Really, meditation is just basically there's thousands of different forms of meditation. I say thousands, at least hundreds. I would say hundreds of different forms of meditation. Maybe thousands. There's lots, but it can help release your brain endorphins, natural pain relievers, help prevent pain around your tissues and your joints, help you be in a more calmer state. And so it can actually reduce pain by 90%. I mean, it's amazing. It's just to me, I started meditating probably about 20 years ago, and my practices have changed over the years and what I do, and that's how I became really interested in the healing Beyond Borders practice. But it's just about there's so many things. Our minds are just capable of so much different things, and so I'm going to share a couple short little meditation practices. By meditation, meditation can be as simple as being really, how can I say this? Intentional, like having a meditation to be really intentional and sort through things and think through things. Or it can be where you kind of like try to allow your thoughts just to go away and relax. And that's what we're going to be talking about here. So I'm going to switch my screen. So I'm going to have to stop sharing for just a second, and I'm going to pop up on the handout. We're actually going to be doing a whole support group on meditation. Let
Mm-hmm.
me look here and see when that is. That is on September 9th. It's in 2 months. So kind of
And
interesting.
uh, well, you go ahead. I don't want to steal your thunder in case what I'm going to say
Oh,
is
it's
something that
okay.
you're
Go
going
ahead.
to.
What are we going to say?
Well, so I just wanted to say that I know you said that there's different types of meditation. And then you kind of said something about oh, it looks like she might be having Wi-Fi problems, but I'll go ahead and just keep talking. Um, so earlier
There I am.
she are you there?
I'm back.
Okay. So I was talking about you were talking about music therapy and like how
hmm
different music can make you feel a different way. And Amy, our trainer, actually sent me some really cool meditation playlists. So I just thought that that was kind of interesting that
Yeah.
you were talking about that before, and now we're talking about meditation, and that's so if you are interested in learning how to meditate or maybe just dip your toe in and see how it goes. There are free playlists on YouTube that Amy had sent to me. So if you guys are interested, you can comment in the chat and I'll find that and I'll send that over to you.
Yeah. 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 You can almost like there's so many different ones. Like there are thousands. Like on YouTube, you can find just about anything, but it's incredible. Like sound healing is it can really be beneficial. And sometimes the tones will resonate and sometimes they won't, meaning sometimes they'll really make you feel good and sometimes they'll be uncomfortable. If they're uncomfortable, that's not always a bad thing because basically it's just kind of helping change the tone of your body, like actually helping your body kind of reacclimate. Sometimes you just got to use your intuition and what you're guided to. That's what I'm going to say about that. Because sometimes things don't feel good and they're not really good for you, but sometimes they do. Does that make sense? I hope
Yeah, just listen
you
to your
know.
body. I think that's another important message
hmm
with this topic too. It's your body. So if something doesn't feel right, then it's not right. And just because it works for
hmm
one person doesn't mean that it's not okay that it won't work for you. It just means that you're different. So,
Absolutely, absolutely. Okay, I am going to let's see here what we got on the questions here.
Tara Lynn, I will find that playlist for you. And Brenda, you can keep going. I don't want
Okay,
to.
sounds good.
I'm just going to mute
Sounds
myself while
great.
I'm looking for it.
Okay, so meditation, and this is our last handout. So I'm going to share my screen. Okay. And this is what the handout looks like, but we're going to go and make it really big so that you guys can really see here. So, meditation, mindful practices. I actually have two. The first one is called Nothingness, Train Stop Utopia. And then the second one is called Stability of the Square. I'm going to pick one just because of time's sake. The first one, I can't do it. I gotta tell you about both. I'm gonna tell you about the first one, but we're gonna do the second one as an exercise. Okay. So, or let's just do this one. Let's do this one and I'll tell you about the second one. I'm kind of being indecisive, aren't I? I'm sorry. Can you hear me okay, Brittany? Did I lose you?
Just sorry, I muted myself because I didn't want
Oh,
you
gotcha.
guys to hear me
Okay.
clicking away on my keyboard. But honestly, I mean, I don't have anything else to do if we go a little over an hour. I mean, I obviously want to be respectful for everybody's time. So if you guys would like to hear about both of them, let us know in the chat and we'll give the people what they want because that's what we're here
Yeah.
for.
We will. And these are going to be available by handout too as well.
Yes.
So the
Yeah.
very first one, we're going to do a short little meditation. This is basically just to help with quieting your thoughts and helping you with just kind of getting in that state of nothingness. So everybody just kind of close your eyes. And I want you to kind of get into a more relaxed state because that will help with this process. So just kind of take a deep breath in. And if you do that, just kind of relax your body as much as you can, your neck, your shoulders, your back. If you're sitting in a chair or laying down, just kind of get your body in a comfortable, relaxed position. Now take another deep breath in and let it out. One more time, deep breath in and let it out. Now keep your eyes closed, and I want you to imagine being in a train station and place yourself and all your thoughts into one of the busy train cars. So think about your thoughts as being all the people around you. So they represent the people around you. So if you have lots of thoughts in your mind, you're going to have lots of people in the train with you. And the people on the train represent um, your thoughts and allow the train to make stops. And at each stop, passengers exit, and so do your thoughts. So what happens is we're going to be riding along, and we're making our first stop. So at the first stop, I want you to allow several of the passengers, or however many of the passengers that you want, to let off the train. So as they exit, those are your thoughts exiting. And now this train's starting back up again, and we're going a little more distance, and the train is slowing down, and the train is stopping, and then some more of the people are getting off the train, and your mind is quieting even more. And so we're going to be going a little further. The train doors are closing, the train's driving a little further, train slowing down, and the train door is opening, and more passengers are exiting. And this time, let all of the passengers out. So there's no more. So the doors are closing and you're continuing to sit on the train until you're alone until the train comes to its final stop and destination. And here you sit in the silence, the space between your thoughts. And then just kind of take another deep breath, let it out. And that's as simple as it can be to just kind of, sometimes it's about helping a little exercise to help us with getting rid of the thoughts, or I shouldn't say get rid of them, but just to slow them down. So what do you think, Brittany? Any comments?
I think that Dorothy has to go, and that's okay. You can rewatch this the later. And Dorothy, if you have this link, you should be able to just click the same link, and it'll replay for you.
Absolutely.
Thank you for joining,
Okay.
though.
Yeah,
But
yeah.
I loved that. To be honest with you, I got maybe a little too relaxed and a little sleepy now.
That happens, right? Oh,
Yeah.
I'm changing screens here again. So I'm going to go back. I'm not going to do the second one just for time's sake, but I want to kind of just talk about it, and then people can repeat it and do the process. Basically, it's about just concentrating and focusing on your breath and envisioning a square in your mind. So you use your in breath to trace the top of the square, the out breath to trace the side of the square, the in breath to trace the bottom of the square. So you're kind of going around, and then the out breath to the outside of the square. So you're kind of just making a square, and you repeat the process as many times as you would like, slowing the breath each cycle. So that is, what I'm calling the stability of the square. It's a little exercise that kind of helps you just slow down and see these things. I wanted to give you guys things that would be super easy and super simple just to do like in a minute or 2 minutes. Something if you don't feel like having to meditate an hour or 2 hours in the time you have available, short little exercises like that can be super helpful.
Mm-hmm.
So, okay. So we want to, Brittany, I'm going to kind of look and see what we have left because I think we have,
We
we
have
have some,
two questions still that aren't answered
yes.
yet. So,
Let me just briefly touch on those. Let me get to the
okay.
questions.
I wasn't
And
sure if it was a question from someone in the chat or not. So that's what I was looking at. Okay.
few methods of exercise to promote healing and decrease pain. So on that, what I'm going to just say is, let's go to our little slide here and I'll just share those real quickly. Body work, yoga, Pilates is what we're recommending here. Work the core muscles and increase your flexibility, strength, and balance. It can help reduce or prevent neck or back pain. You can also incorporate that into breath work and meditation practices as well. And then I'm going to stop sharing for just a second and then go to the next question. That was the chiropractics, and we talked about that already. So I kind of skipped putting that on um, the other. Nicole says she's from Missouri. Hi, Nicole. We're from Missouri too. Where I'm
Well,
from, Perryville. And well, Brittany is actually from Illinois. We work out of St. Louis
I'm
area.
about 35 minutes from St. Louis, so I'm literally just on the other side of the Mississippi River.
Let's see. Okay, I'm going to share one more thing here, and then we're going to share our prize for you guys, the gift that we have for you guys. So, the last thing that I have here with screen sharing is biofield therapies, and that was the what I was talking about earlier about being the healing work that I have learned, and that was in energy therapy. And it uses gentle hand techniques to help repattern the energy field and accelerate healing of the mind, body, and spirit. And it's based on the belief that human beings are fields of energy and in constant interaction with the environment. And some examples of that is healing touch, therapeutic touch, and Reiki. So they can help with all different kinds of medical issues, not just pain. Helping and strengthen the immune system, recovery from surgery, neck and back problems, cancer care, all different kinds of things. So I had to mention that because that's like one of my own favorites. And so in closing, traditional examples include medications, over the counter supplements, nutrition, cold versus heat therapy, self care, chiropractic techniques, and massage. Non traditional, some examples of that include aromatherapy, herbs, art therapy, music therapy, color therapy, meditation, body work, and um, other biofield therapies. And then methods and exercises include aromatherapy, essential oils, herbs, color therapy, and meditation. And resources we have here listed. So want to take a minute before we kind of go in to talk about our sponsor. So I'm going to stop sharing my screen here for just a second. And we want to see if there's questions because we definitely want to give you guys an opportunity to ask questions or anything like that. If there's any. Do you see any, Brittany? Is there anything?
Not yet. Hold on. There's one down here. Oh, I think we answered that one already. It says, "Can you talk more about therapies such as chiropractic techniques and massages?"
Okay. Yeah, I kind of just didn't push the button on that one.
That's
I got a
okay.
little mixed up. Um, I am going to share our gift to you guys for those of you who've attended. And so I'm going to share my screen here one more time, back and forth, back and forth. And here we go. Share. We're going to go to the PowerPoint. And we want to talk about our sponsor, which is ProCare. ProCare is a multivitamin company. If you guys haven't heard of us, you'll have to check out our website, which we'll give you here shortly. They're known for their very low prices, extremely good quality products, and that we have a one a day product that makes it super easy for taking, for ease in taking. The code like if you, Brittany, I'm going to have you show our website here in a second, but the discount code for being here is PAIN SG, meaning support group, for 10% off products now through the end of the month. And actually, you know what? I can probably follow this link and it'll probably take me there. Let me try that and see if it'll show on my screen. Can you guys see that? Are you still there, Brittany?
Sorry, yeah, I muted myself because I was typing again. I forgot to unmute myself.
Oh.
But yes, I can see the website. That link worked.
Okay, great. If you haven't ever tried ProCare, there's a little button here at the top. It's procarenow.com, and there's a little button that says free sample. You can press that and you can put in your name and address and all of that and get a free sample. If you're wanting to use that discount code and you want to look at products, you can look over here under products, bariatric multivitamins, calcium supplements, proteins, the
Will you
bariatric
scroll down?
multivitamins.
Oh,
Yeah.
sorry.
What would you like
So
for me to do?
go back to the free sample real quick because we get this
Yeah.
question asked frequently. So if you scroll, can you scroll down to the very bottom?
Sure. Absolutely.
Your message here box, which is that very last box, if you guys look at our website and let's say you see a product that you would like to try a free sample of, because it is randomized unless you specifically
Mhm.
tell them what you want. So if you see a product on the website that you really like to try, like let's say a particular formula or like let's say you'd rather try the capsule over the chewable or vice versa, or even the calcium chews that we have. If you have a particular
Mhm.
flavor, you can put that all in there and they will send you the samples that you are specifically requesting. So I just wanted to make sure I said that because some people request free samples thinking that they're going to get one of everything, and unfortunately that's not the case. But if you have something in mind, just type it in and we'll make sure you get it. So
Absolutely. I'm kind of going down the list. So that's about ProCare, and I'm going to stop sharing because I was going to allow you to also share about our sponsor, our Crowdcast channel.
yes, okay, I have it pulled up. Okay, I just want to make sure I had it pulled up before I start sharing my screen.
And looks like Randy's going to have to leave in a moment too. Yes. Thank you, Randy, for joining us. We
Yes, and
loved you
good
being
luck.
here.
Good luck with
Yes.
everything. Uh, share. Okay, can you guys see this?
Yes.
You can.
Hmm.
Oh, okay. I will copy and paste this link in a moment, but if you go to this web page, see how it says following here? I believe it's a blue button and it will say follow. I'm already following Procare Health's page, so that's why it's not showing it. But if you click follow here, then you'll get notifications on upcoming events that we have, and you'll actually even get reminders 10 minutes before the event, I believe. Um, and here are some of the upcoming lives that we have. Obviously, this is our support group that we're still on air right now. But here's some of the live events that we have. Next week, we're talking about habit changers, identification, and triggers. And then the following week, we're going to talk about tools for transforming those habits. I mean, I think we all can agree that we have some habits that we probably shouldn't have. At least I can speak on my behalf. I shouldn't speak for everyone, but um, and I'm really excited. This one's not until next month, but I'm really excited to talk with Dr. Susan Mitchell about fighting inflammation with 7 foods. So if you guys have had inflammation problems, especially after surgery, that would probably be a good one to listen to. And then we also have a guest speaker who is our registered dietitian with ProCare Health. She's going to be talking about protein and what's the best kind of protein that you can get or the best supplements out there if any of you are struggling with that. And then actually we do have another series, or we have a series coming up with Amy, who is our trainer I was telling you guys about. I'm really excited for that one. And then we have all of these ones that you can watch replays for. So I don't want to go through all of them because we'll probably be here till 7 o'clock. But you can go through, look at all of them. We have a guy's perspective on here. Randy, if you're still on here, if you're interested in listening to what Rob has to say, especially because you are pre-op, that might be beneficial for you. And these are all free, as we said before, too. They don't cost you guys anything. And there's 2 pages on here, and I think there's a total of 38 events. So you can just binge watch them or listen to them, whatever you want to do. But that's all there for you guys. And I miss anything on that page before well, I
No,
already
not
stopped
at
sharing.
all. Thank
Okay.
you. Thank you for sharing. So, so if
Hmm.
there's no more questions, I guess we'll be closing, but we want to thank you guys all so much for being here and being a part of our group and sharing, sharing everything with us and um, being on the call. So, the survey, if you guys have time, Brittany posted that.
Oh
There's a
yes, I'm gonna
survey.
post that. I'm gonna post it again so you guys don't have to scroll all the way up.
And then if you want free samples, we have the link for that. If you are to the ProCare Health website, if you want to follow us on our ProCare channel, we have the link to that. So there's lots of links. And this is available for replay. As soon as we get done, it'll take it just a moment to finish processing, and then it should be available for replay with the same link that you used to register. You just click on the same one. And that ProCare channel will bring you to all those other topics that you can click on and check out as well. So thank you guys all so much for being here. We wish you a most blessed rest of your Thursday and weekend as well. We're going to be hitting Friday soon and the weekend. So enjoy and have a wonderful, wonderful, fantastic week's end.
And hopefully we'll see
So,
you guys next month.
yeah, yeah. Thank you so much. Bye bye.
All
And be
right,
sure
bye
to share
everyone.
this. Share it with your friends.
Yes.
You know, if your friends have had surgery or preparing. So, thank you so much.
All right. Bye everyone.
Okay,
Have a
bye
good night.
bye.